Hello world. We will be discussing about tinnitus. Goal of kundlasmd channel is to simplify healthcare information. Tinnitus is a sound. People describe this sound in very differently. Some say it's ringing, some say it's hissing, some people say it's blowing, and there are multiple other ways people have described. People continues to have this sound without any stimulus, to the point that it drives people crazy. It affects about 10 to 15% of US population, meaning that at a given point, 15% of us are having either chronic dizziness or episodic dizziness. 2 million Americans are disabled by this disease. It provokes a severe emotional reaction. You have sensation without stimulus, plus you have a high emotional quotient, then you have a recipe for pain and suffering. The question could be asked, why this thing happens? We need to understand the anatomy and physiology of our sound apparatus, which involves external ear, middle ear, inner ear. From there, the nerves arising, going to the brain, and auditory cortex and the surrounding area in the brain. Whenever there is a sound, the pinna collects the vibration, and through external auditory canal, they are transmitted or they strike a tympanic membrane. On the other side of the tympanic membrane, in the middle ear, we have 3 bones, and the way these bones are placed, their job is to amplify the vibration. Sound wave gets converted into mechanical waves. These bones transmit these vibration to the internal ear. Cochlea is a snail-like structure which is filled with fluid. It has multiple cells which are projecting hair into this fluid. When sound wave strike gets amplified in the middle ear and then transmitted to internal ear, this vibration sets the fluid into motion. When the fluid is moving, those hairs, like particle hair cells, they get stimulated. On the other end, they have nerve fibers. Vibrations gets converted into electrical current in those cochlear portion of the vestibulocochlear, and they are transmitted through the brainstem to the auditory cortex. The auditory cortex is the area where different vibration and the sounds are interpreted. Next to ear, we have muscles. We have one main artery which is carotid. With this background, understand tinnitus. There are multiple theories. None of them so far has been confirmed. Only thing we know is that these hair cells are screwed up. They are sending impulses to the auditory cortex. The main problem is the hair cells. Our brain is a very lazy machine. Anything we do repeatedly, whether it's a good habit, bad habit, any activity, it automates, habituates, and forgets. But in this case, there is some changes we are beginning to understand happen in the auditory cortex, which keep on interpreting this stimulus and does not habituate. There are 2 places we know so far in tinnitus that the hair cells are creating impulses and they're sending to the brain. And then the second part is why brain doesn't habituate and keep on interpreting the stimulus. What could be the reasons? People who are involved in activities which involve significant exposure to sound, like construction workers who are working with the jackhammer, individuals who are in the music industry and concerts, they are highly susceptible to barotrauma or the sound trauma. These are the people we know get more tinnitus. So there is a theory that there is a damage to these hair cells from the sound. We all are exposed to a lot of sounds from different sources, our TVs, our phones, our gaming computers, our cell phones. We have continuous exposure to a lot of sound, which was not the routine evolutionary. In the evolution, we didn't have any of these things. The science believes that these hair cells get injured, destroyed, or malfunctioning through sound. Exposure people who have recurrent infections, they are also at high risk for developing tinnitus. Aging is magical. As we age, the incidence and prevalence of tinnitus increases. There are a lot of medications, especially over-the-counter pain medications. The common medications are ibuprofen, Aleve, naproxen, Ketorolac, and multiple other pain medications or non-steroidal anti-inflammatory medications. They can lead to hair cell dysfunction. Next class of medication is diuretics. We use it a lot for different reasons. You have leg swelling, congestive heart failure, cirrhosis, renal failure. These medications are used a lot, and they are directly ototoxic and lead to tinnitus. Antibiotics, especially called aminoglycoside, are ototoxic. Tetracyclines, there's another kind of antibiotic can do that. A lot of chemotherapeutic agents can give you tinnitus. There is element of genetic predisposition. Certain families have a higher sensitivity to sound, and they are more prone to develop tinnitus. There are multiple etiologies and multiple ways you look at it. The main fundamental thing is hearing loss. If you have ringing in the ear, you must get your hearing tested. I think out of all these studies, tests which we will mention soon, if one test makes perfect sense, is getting your hearing tested. The theory behind is that if you lose your hearing, then your brain's auditory cortex, or the brain where the sound is interpreted, that fills in the gaps for the hearing loss. The theory in chronic tinnitus lasting more than 6 months is that our auditory cortex is compensating for the hearing loss. Let's put this thing together. So if there is a problem in the external ear, there is a problem with the pinna, or the external artery canal is blocked up with the wax, or there is an inflammation and infection, there will be that can lead to problem, and could be one place where you could have issue and lead to tinnitus. Second, children and adults who get recurrent middle ear infection, they are at increased risk of developing tinnitus. Age, hearing loss, medications, genetics, and then high sound exposure, they all can lead. Next, we have a temporomandibular joint. Anything wrong with the temporomandibular joint can also sometimes contribute to tinnitus. If there is any musculoskeletal problem in the neck, sometimes it can present as tinnitus. If there is a blockage to the artery, the main artery is carotid artery, and you hear external sound, those could be transmitted sounds we call pulsatile tinnitus. You could hear that there is a synchronization between the pulse and you hear a sound in your ear. These are the common reasons or common places: your external ear problem, your middle ear problem, and then middle ear is connected to your throat to be as eustachian tube. Some chronic sore throats can lead to inner ear problem, your hair cell problem. Then let's go to the brain. If you have certain diseases like multiple sclerosis, where we lose the sheathing around the nerves, that can lead to abnormal auditory cortex behavior if it is involved, and can lead to tinnitus and ringing. Meniere's disease can lead to dizziness and vertigo. So far, what we have established is the problem could be right from external ear, middle ear, so your throat, inner ear, and then also it could be a problem in your cochlear nerve, could be in the auditory cortex. You must pay attention to. Pulsatile tinnitus. There is blockages in the arteries which is conducting these sounds. If this happens in the arteries, we could have a carotid artery stenosis and stroke. How do we diagnose it? If you go to a physician, what do you expect? Because that was one of the question one of my patients had, is that she had tinnitus, which was very disabling. I think she was one of the 2 million Americans whose life has been kindly shattered with this tinnitus. So she had question, what she should expect, because she had seen 3 ENT specialists in the past. She has seen multiple audiologists, and she was not satisfied. She could not comprehend or could accept that this is a condition where there might not be any cure, and all the ancillary treatment therapies may not be effective. Every diagnosis starts with the complete history and physical. Like when you go and come to our offices, we start with your problem, then we elaborate on it. We ask lot of direct leading questions. That's the history part. After we are done with knowing about the complete history, and the history questions will be directed mostly towards any external ear problem, middle ear problem, inner ear problem with the nerve, brain. We will assess your past medical history, your current medication, your surgeries. We will interpret this information in relation to your overall health. We will examine you. Most of the time, the examination is focused on the ear, nose, throat part of it. We will check your throat, we will check your TMA joint, we will hit to your carotid arteries, we will check your external ear. When we're doing the arthroscopic examination, our limitation is at the tympanic membrane. We cannot look at in the middle ear or the inner ear. Some kind of a radiological study, CAT scan or MRI could be ordered based on what your physician is thinking. We have established so far, most of the time, we do not have a reason. We only know we have some coincidences that is more common as we age, if there is exposure to sound, some genetic, some medication. But you rule out the red flag signs, that is, there is no change in your tinnitus pattern, you're not losing weight, there is no other cardiovascular problems, it's not unilateral, there is no symptom suggestive of any brain problem. When you rule those out, most of the time it's reassuring and then explaining you in detail. And that video is dedicated to you, ma'am, because I wanted to ensure that I go over this whole journey with you so that you understand your disease process. What kind of tests? She already had these tests. She had audiology test, that she didn't had hearing loss, ENT examination, multiple MRI. She was extremely anxious, extremely depressed, and to the point that it was affecting her relationship. And even though she has very supportive family, it was a major issue for her. There are some stimulatory tests which they could do regarding the inner ear, which can be done in specialized center. There are not too many things which we could offer you which can help. One message which I have is that if you ever have tinnitus, you make sure that you decrease sound trauma, cut down your exposure to sound. That's one. And second is you must ensure that you don't have a hearing loss. Let's go over the treatment. After even establishing that there is no good treatment, we have certain things which we could do. We are not totally helpless and we are not at the mercy of this disease. We must do something about that. And there are a lot of things which we can do. One of the most common thing which is helpful, ensure that you don't have a hearing loss. Number 2, ensure that your external ear, your TMJ joint, your carotid artery, your muscle, and there is no wax. If you have any of these things, you take care of that. Then, if you have a chronic sore throat, make sure your eustachian tube is open, and that will help. There is no medication which can directly help you, but indirectly There are medications we call anticholinergics. They decrease activity in the hair cells and can give you some temporary relief. But it's not a direct medication to help. Anti-anxiety medication to control your symptoms, because there are two things happening. One is the ringing, and second is the emotional component around that part. Many times we end up using antidepressants. If it's difficult for you to sleep, as the sound in relation to background at night becomes louder, we end up using sleeping medications. We use a lot of therapies to make you aware or habituate your brain. Those include cognitive behavior therapy, mindfulness therapy. What that means is we are training your brain to pay less attention to these sounds. That is either through cognitive behavior therapy, meditation, mindfulness. Or sometimes what we do is we create alternative stimulus. You might have seen that you have a pain in one part of the body, but if there is some injury on the other part of the body, you forget about the first pain. This is the same principle which we use in case of tinnitus. We call it sound therapy. There are multiple ways we deliver sound to your brain, whether through the app or through some devices which we put it in, and we create external. What we are doing is we are creating a counter stimulation to dampen your tinnitus. So you're paying more attention to this stimulus and paying less attention to your chronic stimulus, and usually it is a lot more tolerated. A lot of therapies which have been tried, the music therapy, this one is, then apps. There are some hearing aids which can send alternative stimulus like the sound therapies to your brain. The sound therapy or the counter stimulation has a lot of role. A lot of people find music, they continuously play the music. The same principle, what they're doing is they are trying to dampen their original stimulus. What are the other things which I could do? Healthy lifestyle is shown to help significantly building coping mechanism to help you to tolerate tinnitus, and also it helps to prevent. The best thing which we could do for tinnitus is prevent. And the prevention, only thing which we know for so far is the two things. Number one, avoiding sound exposure. Second is, if you have a hearing loss, replace it with hearing aids so that your brain doesn't fill in the gaps. What are the lifestyle changing? Each human being has 5 domains. All of us have a body which needs proper nutrition, exercise, rest, and entertainment. Make sure your diet is balanced. Balanced diet is high in plant-based. Bulk of your food is plants, legumes, whole grains, meat to taste, and it should be lean, and quality fats and nuts. It will provide your brain proper nutrients, your neurotransmitters, your hormone levels will be normal, and it will help you to dampen tinnitus. Second, exercise. Both strength training and cardiovascular exercises are help to prevent. The message is 30 minutes, 5 times a week, preferably 7 days a week. Sleep 7 to 9 hours. That's the most controversial. People don't pay attention. Sleep is very important. Social stimulation or entertainment also is shown to significantly decrease your tinnitus. That is on your physical domain. Second domain is our emotional. If you are irritated, depressed, you are increasing, you will be more apt or you're more sensitive to developing symptoms or sensitivity to these sound stimuli. Make sure you're properly treated for anxiety, depression, and other psychiatric disorders. Third domain of life is your intellectual or cognitive. Make sure you keep yourself brain occupied. read books, do what else, so that your brain real estate is involved in doing other intellectual work and paying less attention to chatter. Spiritual domain is the fourth one. I'm not sure how I could put it together in the treatment plan. That's up to you. Our social environment, make sure it's quiet. We avoid sound. We avoid major trauma. This question came in over and over. Gaming computers and the headsets, do they lead to tinnitus in future? It has been studied and they could not conclusively say yes or no. But let's put this thing intuitively. In the whole talk, we have been discussing exposure to high frequency sounds is one of the biggest reasons to develop tinnitus. We want to make sure that we do not expose yourself. I have a working theory on this one, and I truly believe it will lead to tinnitus, and the individuals who are exposed to this kind of sound trauma will have a higher incidence of tinnitus. Medications are not very effective. There is a lot of information on the internet and YouTube videos which are promising you how you could treat your tinnitus with this diet, this exercise. I think those are gimmicks. Proper nutrition, proper sleep, exercise, ensuring you don't have red flag signs, ensuring your sound treatment, you don't expose to high frequency sounds. I hope this was helpful and we have covered a lot. If there is any more questions which I have not covered and you want to know, I'll be more than happy to answer it personally. We have a YouTube channel, kundlasmd, and other social medias. Please subscribe to our channel and also share our content with others. We do YouTube live and other social media live sessions every Wednesday at 7 p.m. and Saturday 7 p.m. and we post content regularly. Thank you very much for giving us attention, and I'll see you in next session. Thank you very much.